Okay, there is a new way to treat hair loss using platelets from your own blood.
That Carmen has a closer look at how using plasma from your platelets can help increase hair growth.
Okay.
Hi, Carmen.
Good morning, everyone. So many of us, both men and women, we experience a little bit of hair loss, no matter the age that you are. But here, there is a solution. Dr. Alexandra Mayer here with us from Ethos Integrative Medicine. Tell us a little bit about this process. This is something that's very unique here in the state of Arizona, one of its kind, actually.
Yeah, so what we're doing is we're injecting the patient's platelets, the part of their blood, back into the scalp to stimulate hair loss. To regrow the hair. And what we're doing is the first step is that we're actually getting the platelet count. So what matters the most in PRP treatments is that you know what you're injecting. Research shows for hair loss that you need 1.5 to 3 billion platelets per milliliter, which is a really high amount. So the question becomes, how do you know if you're getting that? Well, we actually brought in this platelet counter, and we're the only one in Arizona with this technology currently. And what we're going to do is we put her platelets on the slide, and we're going to close it, and then it will read and tell us the exact amount that we're going to inject in her treatment today.
Yeah, it's kind of like a little floppy disk reader. We've already drawn her blood, and we spent it around as we showed for the teas a little bit earlier. So now we are actually putting it inside of the reader, and then we're going to inject it, right?
Yeah. Okay. So let's go do her treatment.
Yeah, let's do that. Okay, what we're showing you right now is a before and after picture of the patient that is, she's actually sacrificed herself to to be with us live on Fox 10 this morning. So tell us a little bit about what it feels like whenever you're actually getting the treatment done, because this isn't your first one.
No, it's tolerable. You definitely can feel it. Sometimes you ask for a break in between, but it's all worth it in the end.
You said that you've seen major progress. It's really helped to boost your confidence and all sorts of wonderful things like that. This isn't your first one either, right?
No, I went through the series, which is 3, and now I'm getting a 4th one today.
Yeah. So tell us overall how it's been like so far for you.
For me, it's totally given me confidence. The picture is worth 1,000 words. Right. I'm very grateful. I'm very grateful I found out about Dr. Alex.
Okay, so we're doing that right now. We are actually doing the injections, and it seems as though you just pick different spots of the scalp, right, Dr. Mayer?
So what you want to do is you want to make sure that this needle, I buy it from Germany, so it's a special needle, and what they're doing is they're placed about 1 centimeter apart, and that's where you want your injections to be, and then you want to make sure you're getting the entire scalp. And then in areas with a lot of loss, I'll usually go back over it again, and I'll re-inject.
So a little bit painful, but you do put some numbing on, which I think is important for everyone to know.
Yeah, so we do an injectable numbing. We do a little bit of a nerve block, which helps. And so that helps a lot. And then, like Darla said, I mean, with me, there's always some areas that you might feel a little bit. And so I tell my patients, hey, you run the show. You need a break, you just tell me. Yeah. So
yeah, the beautiful part about it all is that it's done within 5 minutes or so. You said that usually after the first 2 treatments, you can see the progress, but after maybe the first 3 or so, that's whenever the patient can start to see.
So actually, I will notice a difference after the first one. As the provider, I'll start seeing that they're having baby hairs grow in, and I'll start seeing the difference. Patients usually will notice after the second one. And then we don't do after photos until after their 3rd treatment, because research has shown that that's kind of where the sweet spot is. So what I do is I always have my patients in for their 3rd treatment. We do photos again about 8 weeks later. Yeah.
Dr. Mayer, thank you so much. Guys, back to you.
How long does it take, Carmen, in terms of until the hair really starts growing back in? She's talking about treatments, but is it weeks, months?
Yeah, usually treatments are about 3 months or so in between, so you'll start to see progress probably within the first 3 or 4 months or so.
What an interesting process with that contraption. Carmen, thank you.
And you could definitely see how her forehead, like I said.
No.
Yeah, my 5 head could be like a 4.5 head.
Maybe a 3 head.
In 3 months.